begin. I wonder if this is on.
Should be on, yeah. Rick was checking it, yeah.
Okay, we are going to begin our press briefing this afternoon. I'm Peter Zanoni, City Manager of Corpus Christi. And today will be myself presenting. I'm going to go over some of the statistics. Is it on? Okay, just a second. We're going to get an audio check here. Doesn't sound like. Okay, now it's on, right? Okay, we're gonna start over just in case that wasn't captured. And so good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager. And this is our daily press briefing on COVID-19. We're here today to update you on new statistics in terms of number of new cases, numbers recovered, talk to you a little bit about hospitals and testing. That'll be what I'll do this afternoon. Annette Rodriguez, our Public Health Director, is going to be live streamed to us as she was yesterday with a Zoom presentation. And she'll be talking specifically about general population testing that's going to take place this week at the Concrete Street Amphitheater. And she'll be talking about other things as well to include public health and how we can stay safe, right? So Annette Rodriguez, our Public Health Director. And then Nueces County Judge Barbara Canales has several important announcements to make for the community and the state of Texas, to include restricting vehicular access to in the end, with partners that we have at the federal, state, and other jurisdictions like Port Aransas, 100 miles of beach will be restricted in terms of vehicular access along the coastal Bend region. So that includes Port Aransas all the way down through the Padre Island National Seashore. That constitutes about 100 miles of beachfront that we're going to restrict vehicular access to help keep the area safe and help reduce the spread. Mayor Joe McComb regrets that he won't be able to make it today. He had a conflict, and he did want the community to know that he regrets not being able to be here, but we're keeping him informed, and he'll be here tomorrow. Okay, so that's the lineup for today. We appreciate people watching on YouTube, Facebook, and our affiliates that are covering it, or the community's affiliates that are covering it today live. We appreciate the community watching. It's important that you listen to this information and share it with your friends and family and co-workers and church fellows and so on. It is important. The video yesterday that Annette Rodriguez showed or did, we put that out live, and it did take a little bit of time to watch through it, but every second, every minute of a 7-minute long video is critical, and we want you to listen and pay attention to it and use it and share it with the community. So with that, let's look at the graph for today. We have another record for today, 274 new cases today, right? This is, we've never had a number like this before. 259 was our last high, which was on Thursday a week ago. So 274 new cases, and this is with no significant drive-through test event today. So there was a drive-through on the island that was arranged by the county, and the National Guard was doing the testing, but none of those test results are back yet, especially working with the National Guard. They use various tests, various labs, and it takes several days to get the results back. So the 274 is primarily from tests that have been taken through hospitals, private physicians, and some National Guard tests taken as late as a week ago. So the point is 274 without a huge test drive. We know there's a lot of people out there, over 1,000, close to 2,000, that want to get tested. And that's why Annette's going to talk to us about the Concrete Street Amphitheater test site that'll take place later this week. If we look at the past 7 days, beginning on 6/24, go back one, please. 624 right here, if you count just those, we've had over 1,500 cases of new coronavirus in the last 7 days, okay? Okay, let's look at the donut chart, as we refer to it, and here you can see 2,114 active cases, so that number continues to kind of outpace, obviously, the recovered number. 272 persons have recovered. The total cases that we've had since day one is a little shy of 2,400. So the point here is there's a lot of active cases in the community, over 2,000. And that's why it's important for these people that have the virus to stay in isolation and do not mix with the regular general population so as not to spread the virus. So that includes about 90% of all the cases are still active in our community. Okay, another bad statistic is hospitalizations, number of hospitalized patients. That number on our next graph continues to go up. Today we have 105 people. If we go to the next slide. We have 105 people in hospital settings. You can see a pretty sharp increase over time. A key thing here is that our hospitals in Nueces County, in the Corpus Christi area, are either at or nearing at capacity. So that means beds are full, especially in the ICU area. And we could have beds, but it really takes staff, nursing staff, to manage the patient. And our nursing staff are short. Our relief from the state, we put a request in from the state to get nurses. Every major city in Texas is doing that. The state has an apparatus to help out in situations like this. So we do have additional nurses that have come into the city and are beginning to work at some of the hospitals. However, nursing staff, beds, ICU beds are nearing or are at capacity. And Annette's going to talk to us about that as well, what you do if you think you might have the virus or if you feel sick, because there's varying levels of why you should go to the hospital. And Annette's going to help the general population understand when to go and when not to go. Now, just so you know, there's a nonprofit, or it's like a quasi-governmental entity with the acronym CBRAC, C-B-R-A-C. And that stands for Coastal Bend Regional Advisory Council. And this is a statewide apparatus or entity whose reason for being in existence is exactly events like this. So they help manage hospitals, hospital resources, they help with information. And we rely on CBRAC often during hurricanes, but in a pandemic situation like this as well. So Hillary Watt is the executive director there, and we have a daily, multiple time a day actually, conversation with her. They oversee 19 counties right in the Coastal Bend. Actually, their area is the Coastal Bend, Laredo, and the Rio Grande Valley, and they work with 44 hospitals in that area. So that little background to say that we're not alone down here in Corpus Christi. We're working with a big region to make sure we have appropriate medical supplies and beds and staff to help patients that need the help. And so that's an important thing to know, and we just want to pass it on to you. Okay, speaking of hospitals and patients in our ICU, our intensive care unit, that number is going up as well. There's 33 today in intensive care. And many of these patients are intubated today, which hasn't always been the case in the past. Okay, let's look at some 7-day trending for you in the next couple of slides. I guess number of deaths here is next. So the number of deaths, the key thing on this chart is for 3 months when we first began tracking this, for March, April, and May, over a 3-month period, we only had 3 deaths, so about 1 a month. However, in the past 2 weeks, we've added 5 additional deaths to this count, so we're up to 8 deaths. Unfortunately, and Annette did a great job yesterday expressing our condolences. Every one patient's critical, and every death is a loss to our community. But 8 deaths, but the key message is just in the past less than 2 weeks, really, we've had 5 deaths, where in the past 3 months, we've only had 3 deaths. Okay, let's see what the next chart is there. I think it's going to be, here we go, 7-day testing. So you can see the lines going up and down of the daily test events. But as we explained and have been explaining, testing somewhat lags in terms of reporting to us. So the bars don't necessarily indicate the exact number of tests taken that day, because testing can take place. But numerous testing entities send us information, and sometimes that's delayed in getting to us. So hospitals, private physicians, commercial labs, our own health district, the National Guard, a lot of people are doing testing. And when we report the tests, it's not necessarily the day the test took place. But nonetheless, what we represent here is a pretty accurate, a pretty good general depiction of what's going on with testing. And you can see the red line, or the orange line, is the 7-day average. So we're doing about 510 tests on average every day when you look at the 7-day running average. Okay, and then the number of cases, this chart really tells us where we're at. On the next chart, you can see for many months we were managing this situation well here by following the stay-at-home orders. We had the government, the state government had orders, and national government had orders. But with a lot of those being removed, even our local orders being removed, what we have seen is a huge spike, and we're going to begin to course correct that with some of the announcements the judge is going to make today. And the 7-day average on this, the red line you can see here, is 226 cases per day. That's a 7-day average, right? Back in the day over here it was like 3 to 5 was the average. Now we're up to 226 on average per day the last couple of days. Okay, so I think that's it on the statistics. I'm just going to give you a little bit more information on testing locations. Annette's going to talk to you about the Concrete Street Amphitheater testing event this week. There still are several other testing events that are taking place, including the Amistad Community Health Center. They're doing testing, but it's appointment only, Monday through Friday. There's a number to call them. I don't want to read it out here, but you could check Amistad Community Health online. There's a number to call, or message us during this meeting. We'll give you a number if you need it. Coastal Bend Wellness Foundation is doing tests this week as well, Monday through Friday. CVS Pharmacy is now a COVID-19 test location, and they do tests by appointment only. Looks like 7 days a week. Physicians Premier ER is also testing. They're doing those, it looks like 7 days a week, but by appointment only as well. And then Promptu Urgent Care is also testing, looks like 7 days a week, but also by appointment only. So those are some of the non-city, county, or National Guard test events, test sites, test locations. And as well, Annette Rodriguez will talk to us about the Concrete Street Amphitheater drive-through test that will take place this week. Okay, so that concludes my portion of our briefing this afternoon. We are going to get it translated into Spanish, and then by Gabby, and then we're going to watch a live video from Annette Rodriguez, and then following that, Nueces County Judge Barbara Canales will give us some important information. Thank you.
En resumen, las cifras más recientes indican que en las últimas 24 horas se han reportado 274 casos confirmados por el coronavirus, haciendo un total de 2.394 casos. 272 de los 2.394 casos se han recuperado por completo. 105 pacientes se encuentran hospitalizados. Desafortunadamente, las hospitalizaciones están llegando a su capacidad. Enfermeros de otras ciudades van a llegar a nuestra ciudad para poder ayudar. 33 pacientes se encuentran en la unidad de cuidados intensivos. En los cuidados intensivos, muchos de ellos se encuentran bajo tratamiento con asistencia respiratoria artificial. 2.114 casos aún continúan activos. A la fecha se reportan 8 fallecimientos. La cifra de 274 casos del día de hoy es la mayor reportada hasta la fecha y los resultados provienen de pruebas realizadas en laboratorios privados. Existe una organización, por sus siglas CBRAC, que se encarga de ayudar a comunidades cuando existen emergencias, por lo que esperamos contar con su participación también durante esta emergencia sanitaria.
Good afternoon. Annette Rodriguez, Public Health Director. 274 cases today. To be honest with you, that's way too many cases in one day for our small community in Nueces County. We have got to decrease this number. I would like to share with you 3 take-home messages. The first one is going to sound really simple, but it's so important. Stay home. But I'm going to tell you who needs to stay home. Individuals that are sick, stay home. Individuals that are positive with COVID-19, stay home. Individuals that are vulnerable, what does that mean? That means over the age of 65, stay home, or if you have comorbidities. So I have asthma, but I'm only 30, stay home. Anybody with comorbidities, these are individuals that have high blood pressure, type 2 diabetes, heart disease, the list goes on and on and on. You know, if you have any of these illnesses, stay home. And if you were exposed to a COVID positive case, and this one is really important because I'm hearing the younger population that say, I was exposed to somebody with COVID-19, but that was a couple of days ago. Quarantine for 14 days, that's required. If you were exposed to somebody that was positive with COVID-19, you must quarantine for 14 days. Otherwise, you could still be spreading the virus in our community. Very important. The second one is for employers. This is really important because I haven't mentioned anything about employers. So employers, I'm going to make it easy. If you have somebody that's sick with COVID-19, stay home. That means you send them home. You say you have COVID-19, you can't be here. You're required to be at home in isolation for at least the 14 days. You send them home. Everybody is doing that. So thank you to the employers. Here's where it gets a little tricky. So employers have what we call essential needs and essential employees that are critical for our community. And so everybody that is a critical infrastructure business, they know who they are. So where it gets tricky is I just had a COVID positive employee, but I also have individuals that work around them that have come in close contact with them. What do I do with those individuals? So if you're able to work without them, send them home because they're supposed to be in quarantine for 14 days. But CDC allows for these employers, the employer, to actually allow them to come and work if they really, truly need them. They cannot function without them. They can only come to work if they are not sick. They can't come to work sick, period. But they can come to work if they really, truly need them. Here's the problem. They could still be in what we call the incubation period. And I mentioned it before, this is a 2-day to 14-day time period from the time that you came in contact with a positive COVID-19 person. So it's day 5. 5 days ago, I came in contact with a COVID-19 positive person, and it's day 5, and I went and I got a test. And I know I'm a critical infrastructure person and I need to get to work. So I took a test and I'm so excited, it was negative. That's great. That does not mean that you're free just to take off your mask and to be out and to go back to work. What it means is you can go back to work, but you have to wear all of your personal protective equipment to protect your coworkers, but also to protect the citizens of Nueces County. So you have to wear your mask. If the job, depends on you touching, you have to wear the gloves. And we all know what personal protective equipment we have to wear for our own job. So that's where the employer comes and needs to help us with this, because the employer has to help us and say, you're a contact to a positive. Well, I need for you to come to work. I also need to make sure that you are not getting anybody else sick. You're not sick today, but you could be sick tomorrow. So that's very important because a lot of people have the misunderstanding that I'm negative, so I'm good. I don't need to worry about my quarantine. That is not true. That's misinformation. You still could get sick in the 14-day time period, so you still have to wear all personal protective equipment required if you're going to go to work. The last message is for testing. What I want to say is that we all heard yesterday that resources are limited, and people are asking what kind of resources? Well, we're trying to do analysis of these tests that we do in our laboratory, and we're running out of some of those supplies needed, like nucleic acid, to run these tests and analyze them to be able to tell you if you're negative or you're positive. I'm happy to say that the state has reached out to me at least twice today, probably several times more. There's been many calls, and they're working on getting us the supplies that we need. But what I want to also mention is that these resources will probably continue to be in short supply. And so I want to say this truly, and I mean this from the bottom of my heart, don't panic. There is no reason for you to panic or to get anxiety over, I couldn't find a place to get a test, okay? This is not the time to panic. This is a respiratory virus. We've all dealt with respiratory viruses before, and we know what to do. So what do we actually do? We get plenty of sleep, get plenty of rest, drink plenty of fluids, and take any medications that we need to help with our symptoms. I have a fever, I might take Tylenol. So I have congestion, I may take a decongestion. So you do those types of things. What I did want to mention, and I'm not a physician, so I ask the questions, how do I know when it's time to actually go to the hospital? You know, I think everybody heard I had a family member that was positive. We're all asking the same questions. You know, when is it time? Like if I get sick, I've been fortunate, I haven't gotten sick, but if I were to get sick, when do I know that I need to go to the hospital? So the local health authority explained to me, when you're really struggling to breathe, Annette, that's when you need to go. You're struggling how? So you're getting up off your sofa and you're trying to get to the kitchen and you really can't breathe. You just feel like you can't catch your breath. That's the time to go. You really need to call EMS. You need to let them know, you know, I've been really sick. I haven't had a test, but I know I came in contact with COVID-19 or I am COVID-19 positive and I'm out of breath. I can't even hardly get to the kitchen without catching my breath. I need to go to the hospital. That is the time to go. Not sooner than that. You don't need to go if you have a fever, you have a low-grade fever, you're just wanting to know if you're positive. That's not the right time, nor the right use of the emergency department. We know there's been a lot of hospitalizations. So please let those that really need hospitalization, the critically ill individuals, go to the emergency department and get in and get service. So the other thing is we are having a drive-through this Thursday at the Concrete Street Amphitheater, and that is going to be July the 2nd. We're starting that at 6:30 in the morning. And so we will do a reverse alert for individuals that have been on our list to get tested. And so if you get that message, it's a text message or a reverse alert message, please respond to it. I think it's one, yes, I still need to get tested, or two, no, I've already gotten tested somewhere else and I don't need to get tested. That helps us to actually get more people in, so that way we can get as many people served as possible. Again, stay well, stay informed, and as always, do your part to keep these numbers going down and not going up. Thank you.
En resumen, 274 casos el día de hoy son muchos para un solo día. Es importante que se quede en su casa si está enfermo, si es parte de la población vulnerable o si cuenta con problemas de salud crónicos. Si usted ha estado expuesto a una persona diagnosticada positiva, es su responsabilidad que esté bajo cuarentena. Los empleadores deben de enviar a sus empleados a sus hogares si se encuentran enfermos. Existen empleados que son indispensables, pero si han estado expuestos a una persona positiva, deben de quedarse en su casa, a menos de que sea indispensable y no haya quien lo pueda reemplazar. Puede ir a trabajar siempre y cuando no tenga síntomas. Debe protegerse y utilizar todo el equipo de protección para evitar más contagios. Ayer le indicamos que estamos bajos en cuanto a recursos para realizar más pruebas. Esos recursos van a estar agotados en muchos lugares y ciudades. Le pido que no se preocupe, esta es una enfermedad respiratoria. Tome los medicamentos que se le recomiendan para tratar los síntomas como la fiebre. ¿Y cuándo debe de acudir al hospital? Cuando está teniendo problemas para respirar, cuando solo al caminar tiene problemas para respirar. Es importante dejar espacio en el hospital a quienes más lo necesitan. El 2 de julio se va a llevar a cabo una toma de especímenes en el anfiteatro Concrete Street. Esa información la vamos a notificar mediante el sistema Reverse Alert.
Thank you so much. Barbara Canales, Nueces County Judge. Today, I have 3 major items to discuss with you. The first is hospital capacity and elective procedures. The second is beaches, beach access, and of course, the July 4th weekend. And the third is the ongoing need for blood so that we can extract the convalescent plasma for that therapy. First, let's talk hospital capacity and elective procedures. You've just been given the summary and the up-to-date statistics, and they are not good. Since I saw you yesterday, we have about 9 ICU beds available. They've been fluctuating throughout the day, but at either rate, we do not like these numbers in emergency management at the city or the county. And as evidence of all of these difficulties, this morning, Governor Greg Abbott issued a proclamation suspending elective surgeries at hospitals in the following counties: Cameron, that's down in Brownsville; Hidalgo, that's Urban Centers McAllen; Nueces, Urban Center Corpus, of course that's us; and Webb, the Urban Center Laredo, to help ensure hospital bed availability for COVID-19 patients in these communities. This proclamation amends the governor's previous executive order to include the 4 counties of Bexar, Dallas, Harris, and Travis. And let me just stop right there in my notes and ad-lib a little bit. Do you remember when we said we're not like Bexar, Dallas, Harris, and Travis? Well, guess what? We are now. The governor's goal is to ensure that every COVID-19 patient who needs a bed will have access to one. This is also my top priority in emergency management. I want to make sure that all our citizens who are ill will never, ever have to worry about whether or not their hospital can take good care of them. Under the executive order, the governor directs all hospitals in these counties to postpone surgeries and procedures that are not, and here's the magic words, immediately medically necessary to correct a serious medical condition. There is an or. The or is to preserve the life of a patient who, without immediate performance of the surgery or procedure, would be at risk for serious adverse medical consequences or death as determined by the patient's physician. Now, we've been here once before as a state, and now we're here really isolated as a South Texas community. And the reason that we've been designated is because of this unprecedented growth that we've seen over the last 2 weeks, and in particularly the last few days. And we're also here because we made a grave error in somehow our behavior completely changed. And when we changed our behavior, this is the consequence: tremendous community spread, so much so that contact tracing is almost pointless because we all have a root, and that's each other. It's happening everywhere, in every zip code, but there are targeted areas, and the governor has tried to address that. Through proclamation, the governor can, of course, add or subtract from the list of counties at any time included in the executive order, and of course, he is always going to do his best to address the surges and hospitalizations that may arise in other parts of the state. This is a very serious situation. The governor would not do this unless we were in serious condition. First of all, let me remind you that Nueces County provides the majority of the hospital capacity for 17 counties in the Coastal Bend area. So, when these procedures are restricted here, they are effectively restricting other counties all around us, even though they're not named. Second, we know that when this ban was implemented earlier this year, many patients stopped getting treatment. They heard the no elective procedures, and they canceled appointments and procedures. They assumed their conditions were not life-threatening, but in many cases, situations happened that their conditions got worse. And that is not the intent of this rule at all. And I want to emphasize that if there is a matter of life or death or an immediate medically necessary procedure, you are going to be able to have that procedure, but it would have to be considered by your physician a serious medical condition. This rule is designed to help ensure we have enough hospital capacity to take care of COVID-19 patients and, of course, to get help to people who need treatment for other conditions. We don't want people to stop getting treatment. This is very, very important. And we want you to discuss your condition with your doctor. Don't make assumptions. Go ahead and have that conversation with your medical provider. He or she will give you good advice. Your doctor may say, we can wait, but let's monitor this closely. Or the doctor may give you the advice that your condition necessitates it being treated now. And so your doctor is going to make these decisions, whether you should explore other treatments, whether you should wait, or whether you're part of that category that can continue and receive that medically necessary procedure. The governor's order allows doctors to make those calls, and that's a good thing. So please don't stop your treatment. Talk to your doctor. Make sure you share your concerns with your doctor, and make sure you all together make an informed decision. I'd like to pivot now to the next piece of the, I told you I had three arenas. Let's go to the second one, and it's a big one. It's beaches in our community. I'm drafting my order as we speak, actually finalizing it, regarding access to our beaches during the July 4th weekend. They will be very similar to the orders we had in effect during Easter weekend. And if you'll recall, it was a long time ago, seemed like days were simpler then, even though we were concerned at that point. But we prohibited vehicular traffic to our beaches, and we're going to do so again today. Pedestrian access will be allowed to the beaches. I've worked very closely in the last 24 hours with Mayor McComb, with City Manager Zanoni, with officials from the federal Padre Island National Seashore through our Coastal Parks Department and Director Scott Cross, and of course the state of Texas Mustang Island State Park, who will have their own rules in place. And if you're interested, I can get you those rules, but they're governed by a different political jurisdiction, and they have completely different rules and access. We all understand and agree that we have to have a common set of rules for coastal parks, and we've tried to achieve that today. I've also reached out to my friend and colleague, Judge Rudy Madrid from Clayburgh County. You'll recall that 3,600 acres are in the jurisdiction of Clayburgh County. However, we manage that 3,600 acres with our Coastal Parks Division in Nueces County. But we are united in this decision that we believe for the July 4th weekend, commencing Friday, July 3rd, and ending basically at sunrise on Tuesday morning, I believe that's July 7th, that it's in the best interest of public health and safety that we close vehicular access. And that includes all types of vehicular, so all-terrain vehicles, golf carts, and whatnot. I know we're going to get a lot of questions. Are your beaches closed? I thought you said you couldn't close the beaches, Barbara. Well, let me say to you that we have been working, as I told you last week, with the General Land Office. The General Land Office is in charge and the purveyor, the steward, if you will, of our Texas beaches. And it's in our own Constitution that our beaches remain open. But when there is an emergency situation, local authorities are granted the opportunity to do everything in their power to assist in that emergency. And in this case, we have deemed it's in the best interest of the citizens of Nueces County that our city beaches, including those from Port Aransas, and our county beaches have vehicular access closed. And I do think that we have learned what happens when we don't protect our community from the tens of thousands of people that love to congregate together on a holiday weekend. We've seen the numbers, 274, 33 in ICU. It's just mind-boggling how we've come so far so quickly in such a negative way. And we did not restrict this access for Memorial Day, as I said. And how much that contributed to our current situation, of course, is completely difficult to say. But we know that the sudden increase that I just mentioned happened 2 to 3 weeks directly after that Memorial Day weekend. And one of the things that I want you to know is that it's always very difficult to know that you are doing something that is so beloved here, and that's, you know, the celebration of our freedom and our country, and to be able to say, don't do it in the way that you love to do it. But I firmly believe that by closing the access roads and by allowing pedestrian traffic, we strike the right balance for public health. And I do believe that those people who live on the beach will be able to have access to their beach. And I think that our crown jewel of Texas will remain open to those who will use it properly. But the vehicular piece of it just has to be thwarted. And so we are united in this effort from Port Aransas down to the National Seashore, and I think it's going to serve us well. I want you to know that this restriction, as I said, goes into effect tomorrow. I will need to sign it in the morning. I will try for the media to get you the language as soon as possible, but if you want to know what it's really going to look like, it's going to mimic, quite frankly, our Easter weekend order. The piers at Bob Hall will remain open, and I think it's important that the RV parks also remain open. There will be no vehicular access for their trucks to leave the RV park to go onto the beach, but they will be able to walk to the beach. So the RV parks at IB McGee, as well as Padre Valle Park, are open for business, okay? There's people there right now, and they can stay there, and they can walk to the beach, but nobody else will be able to drive on the beach. We do not want to return to stay-at-home orders again. We know what a devastating effect that is to our economy, and by doing this, I feel like we're doing everything in our power not to go there. We are doing what we know works, and with this, we believe we can reverse this trend, and let's go back to flattening that curve again. Let me also mention that tomorrow morning, I will be amending, and really it may not be an amendment. I'm going to remove this just for a moment. We're going to amend our mask order. Earlier today, I had the opportunity and part of last night to visit with the 3 CEOs or CMOs, both in some cases, of our 3 major hospitals, Driscoll Children's Hospital, HCA, and Christus Spohn. In addition, I was contacted by the Nueces Medical Society over the weekend. I think I might have mentioned that yesterday. We need to do everything we can to help them reduce hospitalization. Look at what it's cost us. It has cost us our elective surgeries. How long this restriction will be in place probably is dependent upon us. And so therefore, tomorrow I will amend the mask order to include all commercial entities and all public spaces. The exceptions will still be available if you have a medical problem or you can social distance. But we can no longer strike a balance when there is an imbalance. And God, how I wish we could. And God knows how I tried. But it is not possible anymore. And I cannot ignore, nor would you want me to ignore, the advice of the 3 major healthcare providers in our community. When all 3 echo the same thing, along with our health director, our doctors, and our health authority, an expert in the matter, when your hospitals say to you, we need help, we need masks everywhere, we've got to do everything to get these numbers down, otherwise we're going to be 100% full within a matter of days. We're already on the brink, we're already strained. I must react and I must respond. So tomorrow there'll be the beach order and the mask order. Finally, I want to echo what I thought I really concentrated on yesterday, and that's that blood and of course the plasma extracted from the blood is urgently needed. Particularly this convalescent plasma therapy has shown tremendous efficacy with the patients that are in the hospital, and as you can see, with over 105 hospitalizations, we need that plasma now. But after yesterday, do you know how many people actually called that number, 888-0264? 3. 3 isn't going to cut it, folks. It's just not going to work. We need 100 donors to come and help us, and I need your help. So please, just if you hear nothing else today, hear this. We need blood from COVID-19 survivors. Find someone that you know that knows somebody, even if it takes a chain of 10 of us. I know it's within our power to find these folks, to call that number and let us assist you in setting up these appointments. For every person we can say that gives blood, who's a COVID-19 survivor and meets the criteria, we can save 2 lives. Again, if you need more information, coastalbendbloodcenter.org or my office at 888-0264. Again, the situation is quite serious, and it's not meant to inspire fear or panic. In fact, quite the opposite. It's meant to inspire, it's meant to get resolved of what we must do. We must wear masks to protect ourselves and others when you cannot social distance. And do it everywhere, because the situation has progressed to that moment. It would give me such great delight to be able to remove that order and allow us to go backwards where we were a month ago. But we're not there, and in fact, it could get worse if we don't heed this good advice that our 3 hospitals have given to me today. So I stand by for questions. I know there will be questions regarding the orders. Remember, you can email us at county.attorney@nuecesco.com. This is what is needed. This is what is called for. This is appropriate. And I'm sorry to say, it is a sad day in Nueces County that we have to do this, that we have had to have our governor restrict our surgeries. It's a sad day that we have to call upon those to give blood to save others. And it's a very sad day to know that within 2 weeks' time, we've gone from 4 people in the ICU to over 33. Please help me help others today. I thank you, and I hope to bring you better news tomorrow.
En resumen, los avisos más importantes del día de hoy. En cuanto a la capacidad en los hospitales, aún contamos con 9 unidades de cuidados intensivos. Hoy el gobernador ordenó suspender las cirugías selectivas para poder contar con personal médico disponible y camas en los hospitales. La orden fue para varios condados, incluyendo Nueces. La suspensión de las cirugías es siempre y cuando la salud de un paciente no esté en riesgo. Esa decisión la hará su médico que lo atiende. Es importante que sepa que no queremos que su salud esté en riesgo. Posiblemente pueda tener otro tratamiento en lo que se pueda llevar a cabo esa cirugía. En cuanto al acceso a las playas para el fin de semana, estoy finalizando una orden para restringir el acceso a los vehículos, aunque el acceso a los peatones no se va a ver afectado. El cierre al acceso será el día de mañana, 1 de julio, al martes 7 de julio. La restricción es para cualquier vehículo motorizado. Esta orden la puedo mandar cuando se trata de una emergencia, ya que es para beneficio de todos los residentes. El cierre es desde Port Aransas hasta el Parque Nacional. La orden la voy a firmar mañana y va a ser archivada en la Corte. El muelle Bob Hall va a estar abierto y los parques para vehículos recreacionales o RVs también van a estar abiertos. El día de mañana vamos a enmendar la orden para el uso de cubrebocas. Me reuní con los líderes de los hospitales locales. Debemos hacer lo que podamos para reducir el número de hospitalizaciones. La orden va a incluir a todos los comercios y lugares públicos. Esa orden va a estar disponible al público para ver los detalles. Le recuerdo que si usted se ha recuperado del virus, que puede llamar al 888-0264 para que se le dé una cita en donde su plasma pueda ser donado y así salve vidas. Recuerde, usted puede donar cada 28 días y su donación puede salvar la vida de 2 personas. También se puede encontrar más información al portal www.coastalbendbloodcenter.org.
Okay, that concludes our prepared remarks for today. The judge and I are here to answer any questions that you may have.
I kind of have a few. So it has to do with the requests that we talked about yesterday. I know you guys mentioned 21 requests were made. Where are we at with those? Do we know how soon we're going to be seeing a lot of these supplies?
Yeah, let's have the judge answer that.
Okay.
I know some of them, while she's coming down, are on their way. Representative Todd Hunter gave us some information late today. Yeah, so many of the supplies are on the way here. I don't know if you want to add, Judge.
I think the one thing I wanted to add, I was thinking, well, if I get a question, I'll add it, so much information. But we were able to confirm today that, as Manager Zanoni said, you know, we're getting the supplies. They have been acknowledged, and we're going to get them. I don't have a timetable yet. But what was really good is that TDM, Texas Department of Emergency Management, is going to lend us the Guard, the National Guard, to come and pick up samples that we swab, 500, and they will take them to the state labs to process. So when I walked in here at 5 o'clock, that's about the time I got that confirmation, and Director Rodriguez and I are going to work together to get 500 people extra in the queue. So based upon what she's doing at Concrete Street, plus these extra 500, plus I'm working on another 500 from a private lab, I want to get those people who are waiting in line in the queue. I know how frustrating it is to have to be told, we can't, take you today. So we're thinking outside the box and doing things that are extraordinary, quite frankly, to be able to say, we got to get people tested. And so part of that comes from the resources that we're waiting on, but just to make people feel good, we're not waiting on that, right? So we said we do have enough swabs to take the sample. We just don't have enough material to process it. So the Guard says, you know what, we'll come and pick it up, and then they're going to hot shot it to a lab, a state lab, and they're going to do 500 tests for us this week, and that's incredibly welcome news.
You mentioned yesterday that there are over 2,000 people waiting to get tested. You were hoping to have all of them tested by the end of this week. Do you still think that's a logical answer to have?
So I think we're going to get, I know I personally have figured out a way to do 1,000. I've got to figure out what Annette's count at Concrete Street is. I know we're doing 189 people at about, let's call it a 200 county employees and or dependents or relationships to the county tomorrow. And so I'm feeling very good about 1,500 of them so far. I think that, as they say, today, what day is it today? Because honestly, I don't even know, because there's no like sun and light for me anymore, dark. I mean, it's just, but whatever today is, by tomorrow, I'm going to fill that gap for the next 500. It bothers me immensely to not be able to test people, but I will tell you that I try to be accurate, and tomorrow, my hope is I get to answer that question fully. Is it realistic? Well, I think we've done pretty good so far finding filling that gap.
And just quickly, that number 21 requests, that is still correct?
It is 21 requests, and each item is a request. So swabs are a request. The pipette is the little thing that you squeeze, right? You pick up the liquid, right? So from everything like that's a request. So 21 sounds like a lot, but it's all based upon the item.
Thanks, Canales.
I do want to say thank you to all the legislative delegation. We do our job, but they do theirs really, really well. So when Nueces needs help, Senator Hinojosa, Senator Colkhorst, Abel Herrero, and Todd Hunter, the two chairmen, they just do great things. And then the best thing about it is they don't just push, they text us and say, hey, we got your back. The cavalry is coming. Thank you to them.
Judge Canales, just a clarification on the adjustment you're making to the mask order. What is the change exactly?
So the change is, think of it as a all public spaces mask order. Now, there's normal exceptions, and they'll be listed there. So let's talk about those. When you're eating or drinking, you don't have to wear a mask. When you're exercising or doing any outdoor activity, you don't have to. If you're driving, you don't have to. If you're in your own workstation, or where I can social distance, you don't have to wear the mask. So there are a lot of exceptions. If you have a medical problem with masks, you don't have to wear them. But you know how before I had carved out, smaller shops and offices, and there was a lot of confusion of why did I say medical offices? Well, that's because the governor already has an order covering medical facilities, right? But we're not going to mess around anymore with any of those. We're just going to say, guys, wear a mask. Wear a mask everywhere where you can't social distance. And we think that that's going to, and forget what I think, the doctors think at the hospitals, the people that govern our health care say this will make a difference. And so that's why I've pivoted and done this.
My only other question would be, our TAM-UCC researchers pretty much say we're the worst. Like, we have the highest rates
Yes.
of anybody else in Texas. Why not follow Bear County's lead and maybe go to shelter in place again, or stay at home at least.
Right, so I want to be really clear. It's my understanding, and I always come up here and try to impart my legal, background, but stay-at-home orders are in direct, in my opinion, conflict with the governor's orders. That's why county judges have asked the governor for that ability, right? That's my understanding. So what we've said is stay at home if you can, limit it to your essential activities. We've talked about that vulnerable population that Annette really did a great job of outlining, but we're not on stay-at-home orders because they are in conflict with the governor's reopening orders. And that's really important to understand. But judges, just so you know, have asked the governor for that power. And there was a letter that was circulated from other urban counties, including Bear, saying that. So our statistics are the worst. And that's why I say to people, you don't like this? You're going to hate stay at home again. You're a restaurant, you don't like this, you're going to hate it when your restaurant's closed. Please help by making this the lesser of the two. And that's really what it's all about, is that we got to find a way to live with this virus. And I'm afraid that it's not going to go away. We thought it was seasonal. This is not, what season, We thought that maybe the heat would kill it. It's 113 heat. I have multiple emergencies going on today. Today there was a heat index of 113 degrees. So what we have is a scenario that requires us to behave differently. And masks are only one element of it, but it's a huge element. And we think by doing all of these things that are so unpleasant, including closing our beaches, that we can make a big difference so that 2 weeks from now, those numbers are going way back down. And remember, when you see a number, they're real. Those patients in the hospital are real. Don't get caught up on, it's this percentage of the population. What you need to know at home is that we're getting 30% positives every time we do these mass testings. That is why our numbers are so huge. And the people that want to get tested typically don't feel good. That's why they want to get tested. So what you need to understand is that per capita, per individual, we are way out of whack. And that's why we got lumped into this restrictive surgeries order with all of the counties from the valley.
Does the city plan on closing anything and following the county's lead?
Yes, the city is going to support the closure of the access road, so we'll be the ones actually making sure the roads are closed, those access points onto the Gulf beaches. Additionally, we're going to be closing the 2 beaches on the bay, so North Beach and McGee Beach will be closed those same 4 days. And then finally, the city is going to close 8 regional parks where large groups tend to congregate during holiday season. So parks like Labonte Park, in fact, can you pass that folder? Let me just get those read off for you all. So our 8 regional parks that we have, including Bill Witt, West Guth, the Salinas Park, the Water's Edge Park, Cole Park, Labonte Park, as you enter the city from I-37, Lakeview, and Parker Park. Those 4 regional parks that tend to have, big family and other type parties during holidays. We felt the right thing to do would be to close those as well. The goal is to keep people kind of at their home during the holiday season, during the 4th of July season. So for those 4 days, Friday morning at 6 until sunrise on Tuesday, those 4 parks will be closed. We talked about the 2 Gulf beaches, McGee Beach and North Beach, and then the access roads on the Gulf beaches. The city will have those closed. And then finally, up in Mathis, the city at Lake Corpus Christi has the Sunrise Beach RV park and little lake beach type area. We're going to be closing that as well. We're canceling reservations for persons that may have been planning on camping overnight, and the access to that beach area will be restricted also for those 4 days. in an effort to reduce the spread of COVID-19.
That was Friday morning at 6 until sunrise Tuesday?
Yes, yeah, 6 o'clock Friday morning, and then we'll reopen 6 o'clock a.m. Tuesday on the 7th of July. And the curfew, Judge, did you talk about the curfew? Yeah, I didn't. Yeah, let's talk, the beaches, right, I'm gonna have the judge talk about the curfew that goes into effect tomorrow night for our Gulf beaches and the Bay beaches as well. That'll be for a longer period of time, but go ahead.
Right. So, one of the things that we also did early last week is reached out to the GLO and said, in addition to the vehicular access, we really want to restrict people in the evening on the beach. And that's going to be in effect tomorrow, and it'll start at 8 p.m. and, of course, be effective till 6 a.m. I tried to hit the dusk to dawn scenario. And I do want to reemphasize that I want to thank the General Land Office. I know they don't listen to these press briefings, but who knows? But there's some wonderful people there. And, there's been a lot of cooperation between local authorities and state agencies. And it's very important to have that collaboration. If we don't do that, we're not part of that informed decision-making process. And so I just want you to know that the General Land Office has done a very good job in coordinating with me. And we together thought this decision was the right one. And I think that's important for people to know, because we got a lot of calls about local authority. And you can have local authority, but it needs to be done with the entity that governs the land. And I think we did that well here in Nueces County, and I'm proud of that. I'm proud that our decisions are thoughtful ones, and I'm proud that they're based on data and science and the emergency at hand, and not at the whim or capriciousness of what people emotionally want you to do. I feel like here in Nueces County, there's not a disconnect. It's just the opposite. And that's why I have faith that the things that we're doing today, particularly over this next weekend, will set us on the road to recovery. I really do. I think if we start putting these orders in effect tomorrow, and everybody understands the seriousness of what's happening in their healthcare centers, we can reverse this trend.
Para informar de la comunidad hispana, 8 parques de la ciudad también van a estar cerrados durante el fin de semana para evitar multitudes. Los cierres van a estar vigentes desde el viernes hasta el día martes. Los accesos vehiculares a las playas van a estar cerrados para las playas de las bahías. También Sunrise Beach ya no va a estar aceptando reservaciones nuevas durante este fin de semana. Se le quiere recordar que el cierre de estos parques, del cual le daremos una lista posteriormente, va a ser del viernes a las 6 de la mañana hasta el día martes a las 6 de la mañana.
Better go ahead and say this to my surfer friends. You can still surf. You're going to have to carry your board because we're not going to be able to ride down there. But you can carry your board down there and surf. And I wish you good waves. But I will tell everybody that loves the ocean as much as you do, that the ocean is to be respected and to be admired and to be loved. But at this time, the sand is meant to be silent. And we really need people. If this weekend you can stay away, this is the weekend to do it. And it'll come right back to you in really due time. But I do want to make that clear so we don't have to get those calls. You can still do that. You can still fish, you can still swim, and you can still surf. But it's got to be that we actually believe that we can do this right. If not, all these orders are for nothing. So I would ask for your help this one weekend so that you have many more weekends to enjoy.
Okay, that concludes our briefing for today. Our website's being updated through the days, and we'll be back again tomorrow, which is Wednesday, and then Thursday will be our last briefing for this week. And on Thursday, we'll have our scientists and professors here from Texas A&M University providing an update on their modeling. So we'll see you tomorrow and then again on Thursday. Take care.